Hello, I'm Dr. Mark Topolski, an orthopedic surgeon with Gunderson Health System who specializes in adult reconstruction, primarily hip and knee replacements. I grew up in a small town in New Jersey near Philadelphia. I ended up attending the Air Force Academy. I did play football while I was there, and afterwards spent 6 years in the Air Force doing other jobs prior to deciding to go to medical school. Before I went to medical school, I had also met my wife and we had had our first child, so it's been a long road going through medical school, residency, etc., while raising our family. Medical school was at the University of Virginia, then off to the Mayo Clinic for that training, which really opened our eyes to how great this area is out here. Once I completed my residency at Mayo, back into the Air Force as a surgeon for another 4 years. I spent some time in Afghanistan doing some fairly complex surgeries, as you can imagine. And after that time, that brought us back to this area to work at Gunderson. Ever since then, I've been doing around 500 or so hip and knee replacements a year. Now we have 9 kids. Yes, we think we're done, but always still open to adoption or fostering. Thank you for trusting me and my team to complete your knee replacement. Each year, we perform hundreds of these complex knee surgeries. Knee problems have affected your quality of life long enough. Deciding to have surgery has not been easy, but you've made a good choice given your options. Since you're ready to move forward, I want to tell you what's ahead. We are ready to provide the excellent care you expect from Gunderson. Here's what we expect from you. Learn all you can about this surgery by completing your required education. Keep all your required appointments. Get your home ready for a safe recovery. Ask someone to be your recovery buddy. This person will help keep you safe while you're recovering. Your knee replacement workbook has details on these and many more topics. Start by signing up for my chart, our patient portal. I encourage you to do this. It's a great way to communicate with your surgery team. Read your total knee replacement workbook and all educational handouts. Your recovery buddy must come with you to each appointment. Both of you need to know how to prepare for and recover safely from a joint replacement. It is important to bring your blue patient education folder to all appointments. Information will be reviewed and added each time we see you. You need this information to achieve the best results from your knee replacement. Now, here are some other aspects of joint replacement you need to understand.
Your surgeon will explain risks, benefits, and alternatives for knee replacement. After your questions are answered, you'll be asked to sign a form that gives permission for surgery. After knee replacement, you're going to have pain. You have to work through it and move your knee to get the results that you want. Recovering from surgery is a full-time job, especially the first 2 weeks. You should move your knee every hour while you're awake. Bend and straighten your new joint. This can keep scar tissue from building up. Use ice and elevation to help reduce pain and swelling. We'll tell you how long and how often to do both. And make sure your recovery buddy, family, and friends are well informed and ready to help. We'll provide information your home team needs to care for you.
Our support doesn't end at the hospital door. We'll check to see how you're doing at home. Call us with questions or concerns, especially if you have symptoms like these: severe or lasting pain in your knee, more swelling in your knee or leg, increased redness in or around your incision, you are less able to use your leg since your surgery, your incision opens or it's draining, you have a fever of 101 degrees Fahrenheit or higher. This is what you need to know for successful recovery. To be fully prepared, you have to keep all your appointments and complete all your education. If you don't have paper and pencil handy, pause the video. You may want to take notes on how to contact my department.
If you have questions, concerns, or symptoms, use these phone numbers. For orthopedics and lacrosse, from 8 a.m. until 5 p.m. weekdays, call 608-775-2276 or 1-800-362-9567, extension 52276. After hours, weekends, and holidays, call the telephone nurse advisor at 608-775-4454 or 800-858-1050.
You have a lot to think about. Watch this video as often as you need to. Send us questions through my chart. You've made a very good decision. We want you to get the best possible result from this knee replacement. When you're ready for surgery, we'll be ready for you. Thank you for choosing Gunderson Health System for your care.